For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD, New York's only Harvard-trained, triple board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. I hope you're fine and having a great weekend. And thanks, Therese, for the news. And looking forward to 80 degrees and warming up. This summer has been pretty chilly. There's lots of news today to talk about. Lots of patients, lots of news, lots of information. So we're going to dive right in. And if you have questions, we are live. We're in the WOR studio. Bob and Ed are running the place. Bob and Ed have the whole responsibilities of WOR Studio on their shoulders, and they are fantastic, first-rate, top-notch professionals. You can call them at 1-800-321-0710, 1-800-321-0710. They'll put your call right through, and I'd be happy to try to answer whatever your concerns are. We had a lot of calls over the weekend, a lot of calls tonight. We have shows at 1:30 in the morning and at 3 in the morning. We had lots of calls. People were asking things like, where are you located, which is 1384 Broadway and 38th Street. Do you take my insurance? The answer is most likely yes, we take your insurance, Medicare, Medicaid. We take most insurances. Someone asked, will you see Dr. Lederman? Which was an interesting question because that's what we're talking about all the time. We're a private cancer treatment center that's here for you. So we don't have students, we don't have interns. You see the doctor, and I am the doctor. There's actually another doctor who works there. And we're specializing in taking time with each patient. So it's a bit of a boutique cancer treatment center where we spend lots of time sitting down, going over your documents. Many patients, shockingly, don't even have the documents showing their cancer, showing the pathology to confirm the cancer, or the PET scan, or the CAT scan, or the MRIs to show where the extent of the cancer is. So we go out and get those documents. We'll give you a copy of them. We sit down, we explain it, and then we give you options. And we'll talk about during this program and other programs today what a difference having that information can make. We had one man who got chemotherapy for 5 years at a big cancer hospital, and they kept on telling him his cancer was under control when in fact it was growing every year. It went from 3 to 5 to 7 to 8 to 10, now 13 centimeters, and he kept on getting the same treatment, being told everything is stable. He was shocked and obviously disappointed because they never gave him the documents. They never discussed it with him. It was 2 minutes in, 2 minutes out. So if you like that, great. You can go someplace else. If you like information, documentation, copies for your own records, copies of the images for your own purposes, then come to us. We're different kind of place that spends time with you. We're a private cancer treatment center that works for you, not the drug companies. Anyway, nevertheless, we had a lot of calls overnight, lots of calls this weekend. One of the interesting news articles came out, was just published, and was called the ASCO Post, and it was originally published in Cancer Research, and looked at the use of NSAIDs. So NSAIDs are non-steroidal anti-inflammatory agents, and women who take NSAIDs who are overweight and or obese with breast cancer have a diminished incidence of recurrence of their breast cancer. And that's interesting. If you could take an aspirin, now Americans are always looking for a magic potion, a magic pill, and so many are taking vitamins, antioxidants, which don't seem to work. In fact, it seems just the opposite. Most of the studies show an increased cancer recurrence rate and increased mortality rate with most of those agents. So most of those that Americans are spending $35 billion a year don't work. But if you take something like an 81 milligram aspirin, if you have breast cancer, if you're an obese or overweight woman, you're going to reduce your incidence of breast cancer by about 52%. So it's a huge reduction just by taking aspirin or anti-inflammatory. Why? Well, there's something called the COX-2, COX-2 expression, and it seems that the anti-inflammatory reduces this COX expression, probably because obese or overweight women have higher rates of inflammation. COX-2 is an anti-inflammatory. Obviously, aspirin and nonsteroidals are anti-inflammatories. The women have elevated levels of inflammation, including higher COX-2 expressions, and women that take NSAIDs had a 52% lower rate of breast cancer, presumably because the anti-inflammatories reduce the COX-2 level in their system. It's a dramatic study, and obviously there's 250,000 women a year with breast cancer. Now, this is not the primary treatment. You still need the primary treatment. So whether that's radiation or whatever, you need that treatment. But incidentally, the women that have the good treatment, plus who take an aspirin, will have a markedly decreased level of recurrence of the cancer. And we've talked about aspirin in other diseases as well, reducing cancer rates, including colon cancer. Now, one of the big issues, so for women, breast cancer is one of the big diagnoses. 250,000 women a year. Many of us have had breast cancer in our families, and many of us know of people who have breast cancer. In men, about 250,000 will have prostate cancer, and we just talked about a way of reducing recurrence of breast cancer. What about reducing prostate cancer? Well, there's a 13-year study. It's a European randomized study for prostate cancer. It was reported in The Lancet by Schroeder, and that's obviously a very prestigious journal. And they showed that PSA screening in men 55 to 69 years of age reduced prostate cancer mortality by 21%, and there's absolute benefit at 9 years and 11 years. So it's quite dramatic, and it's beyond dispute. Now you can say, okay, I don't want to get screened, or screening costs society money, or screening costs your insurance company money. Yeah, it's true. Screening means you have to get blood tests. You have to get a biopsy, versus a man who doesn't get screened, doesn't get the blood test, doesn't get the biopsy, but he also has a 21% higher death rate from prostate cancer. So you can choose. You're the president of the United States of your body. Do you want to reduce the mortality of prostate cancer? Get screened. If you're more worried about cost to society, don't get screened. And if you have a comment, give us a call or come in. We can talk about what should you do for your PSA? You can come in and get a PSA if you want. Getting a PSA implies that you're interested in the results, so if it's elevated, what are you going to do next? Are you going to get treated to have that 21% reduction in prostate cancer mortality? And plenty of people die of prostate cancer. I see it. I see people come in, and we'll talk about it today and on other programs, of men who didn't get screened. One man came in with a PSA of 900 with diffuse cancer, and unfortunately, he will die. He's 53 years old, just came in this week. So we can take away the pain and we can take away the suffering, but we can't give him back his life. So when you see that, it makes you want to do everything you can, especially easy things like PSA, biopsy if necessary, to avoid that. An interesting woman come in this week, 35 years old. She's a mother of 5, she's married. She has metastatic colon cancer. She's had it for several years. She came in to me about 3 months ago. She's getting treated elsewhere with chemo, and wasn't working. I asked to get staged to know where the cancer was. You can argue, well, why the heck would she be getting chemo without knowing where the cancer was? Well, if those are your thoughts, you took the words out of my mouth. So she got screened and staged, and she found multiple nodules in the lung, but treated just a couple that were growing. There's about 20 nodules that are not changed. They're unchanged over some period of time, about a year or two. And now her surgeon wants to open up both sides of her chest and remove all the nodules, whether actually none are growing right now, so none are active. She had a PET scan just this week. No nodule is growing. No nodule is active. So why the heck? She has stage 4 cancer. So why would he want to do this big operation on this woman? There's no data to show she's going to live longer. Opening up her chest is like taking the raisins out of raisin bread. And what's he going to achieve? Well, we know what he's going to get from it, but we don't know what she's going to get from it, and she'll probably end up with a lot of pain from bilateral thoracotomy, which is, thoracotomy means to open up the chest. Bilateral means both sides. And we know how much pain many people have just from one side. So she's talking about both sides. She asked my opinion, and I said I would do something other. And that's the whole point of a fresh second opinion. Some people say, I'm going to go talk to my doctor about a second opinion. Well, if you go back to the same doctor for a second opinion, it's not a second opinion. He or she's just going to say, if you don't believe me now, you got to believe me. Well, that's not what a second opinion is. A second opinion is having a different doctor look at the case and give you a fresh way of looking at your situation. And I think everyone deserves a fresh way of looking at it, especially if the treatment isn't working. And this woman, 35 years old, 5 kids, married, with cancer that had been growing until got her lung treated. Now it's stable. Why are you going to do surgery when it's stable? Well, she knows the questions. She can go back to her doctors and ask them and put a little pressure on them to say, why are you going to do this to me? Where's the data? Where's the data? And if you don't have data, then you have to raise a red flag and say, hold on. Maybe what you're proposing is not best for me. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of New York City. We're at 1384 Broadway. We have booklets and DVD. We have booklets about brain tumors, body cancers, and prostate cancers, and DVDs. So if you're interested in more information, you're welcome to call us during the work week at 212-CHOICES. And by the way, we chose that number because we believe that most people have choices in cancer treatment. Like this woman, one choice is to do the surgery, and one choice is not to. So 212-CHOICES is our number, which is 212-246-4237. 212-246-4237. We're going to hear a couple of voices about our work, and they'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer,